Good morning, everybody. Thank you, CII, for inviting us, Mr. Nagar, Upasna ma'am, Devendra, G. Prashant, and the CEO from AAF. Good morning. Um, I just wanted to talk to this August gathering about the Ayushman Bharat Digital Mission, and uh, to be very honest, the fact that we are participating in conferences like this is because of the fact that we understand um, that there is a need for awareness about what the work uh, government is doing in digital health. We are increasingly um, trying to make available information in public domain about the kind of work that is being done in digital health by the government, and also as was mentioned by Mr. Nagar, to partner with all the stakeholders in this digital health, in the healthcare ecosystem, to seek feedbacks, to seek suggestions, inputs. We have come up with various consultation papers and have sought public consultation about this. Before I try to tell you more about what the digital health mission is, I would just like to take a step back and explain to you about what Ayushman Bharat is. Ayushman Bharat scheme that has been launched by the government has four main components. It has the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. It has the Ayushman Bharat Health and Wellness Center. It has the Ayushman Bharat Health and Infrastructure Mission. And the fourth and the most recent one is the Ayushman Bharat Digital Health Mission, or Ayushman Bharat Digital Mission. Ayushman Bharat Digital Mission was earlier known as the National Digital Health Mission. So its name has been changed to Ayushman Bharat Digital Mission. I'll just explain to you about all these four legs in one or two sentences. The Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, I think all of you would be aware of, is the 5 lakh insurance scheme which is provided to the most economically challenged section of our society. The Ayushman Bharat Health and Wellness Center is a concept wherein rather than on treatment, the focus is on prevention, where health and wellness centers, about 150,000 of those, have been set up in the country, and which would be the first centers where people would go and get screenings done or get teleconsultations. The Ayushman Bharat Health Infrastructure Mission, it was launched during the COVID time, which was focused on how to augment the infrastructure in government hospitals, how to create better testing facilities in government hospital, how to make them digital, provide them software. And the fourth mission with which I am associated with, and with which I would want to talk to you in more detail, is the Ayushman Bharat Digital Mission. The Ayushman Bharat Digital Mission, unlike the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, is a universal scheme. It is applicable to 140 crore citizens of our country. It is universal. It does not provide any financial benefit. So what does it provide? It was launched in 2020. In August 2020, it was launched first as a pilot in the 6 union territories of India, and then it was nationally launched in September 2021 all across the country. What is its focus on? Ayushman Bharat Digital Mission is focused on a word that was used by some of the speakers also. It is focused on interoperability. And with my experience in National Health Authority, one of the thing that we constantly find a challenge is that people are not able to understand what exactly the mission wants to do, what it wants to do in interoperability. And I am working in the National Health Authority since May 2021, but to be very honest, when I joined in May 2021, it took me about 3 months to understand what exactly is the mission and what exactly it is not. So I use this example everywhere I go to tell people what this mission is through an example. The example is like if a person goes to say Paras Hospital and the doctor asks, क्या मैं तुम्हारे पुराने पर्चे देख सकता हूँ? The and the doctor has a computer screen on his front. पेशेंट बोलता है यस, जैसे ही वो या यस बोलता है उसको यस जो है वो अपने मोबाइल पे बोलना है. तो डॉक्टर वुड इनिशिएट अ कंसेंट रिक्वेस्ट कि क्या मैं आपके पुराने रिकॉर्ड्स देख लूँ, और पेशेंट के पास उसके फ़ोन में अगर उसके पास स्मार्टफोन है तो उसके ऐप के ऊपर उसको यस बोलना है, या फिर उसके पास अगर फीचर फ़ोन है तो वो अपने OTP बता के अपना कंसेंट दे सकता है. And as soon as the consent is given, the doctor is able to see all the past records of the different visits that the patient has done. The patient is also able to manage कि मुझे मान लीजिए कि दांत का दर्द है तो मैं अपने डेंटल रिलेटेड रिकॉर्ड्स दिखाऊंगा, मुझे मेरे साइकेट्रिक रिकॉर्ड्स नहीं दिखाने हैं तो कितने टाइम के लिए दिखाना है, that also flexibility is there with the patient. This would be very useful, let's say for example in for migrant laborers. Many of the times they go to their homes or they are not there at the place of their residences, or people like us who travel a lot and we would not be able to keep all our records physically in place. With this use case, this mission has been launched. It is about creating an interoperable health system. अगर आप आज अपोलो हैदराबाद में जाते हैं और अगर 1 महीने बाद अगर आप अपोलो चेन्नई में जाएंगे या अपोलो दिल्ली में जाएंगे, and if you say your UHID number and if you have visited Apollo Hyderabad, the Apollo Delhi hospital would be able to see your records because it is Apollo. What ABDM is trying to do is facility A, facility B, irrespective of whether it is a government or private, it tries and links all the facilities and makes data exchange easy. In addition, there is one more very important aspect of this mission is that there is no storage of records. The government does not store any records. So, for example, the consent is given, the record from say Yashoda Hospital moves to Paras Hospital, and we just enable that exchange. We just say कि हाँ इसने yes बोला है तो वो चले जाएगा. We will not store any records, and that is I think the beauty of this mission. The mission is about 2 years old. मुझे एक चीज़ जो हमेशा लगती है कि डिजिटल हेल्थ इज़ अ मैराथन रेस, like the financial sector, wherein UPI has done extremely well in the financial sector. We have been able to use UPI and achieve billions of UPI transactions. In the healthcare space, particularly in the public hospitals where we work, there is a lot of groundwork that needs to be done. At many places we don't have sufficient hardware, we don't have internet connection. The patient load is so huge that the doctor says that if you want me to write digital prescriptions, I will not be able to handle 400 patients a day. So you provide me a man or a resource who will write for me. So it's challenging, and that is why there is a lot of scope of innovative tools like the voice to text, the the OCR, wherein the doctor would still write on a paper which would become immediately digital, or writing on tablets. However, there is a lot of work that needs to be done on this. National Health Authority is uh, trying to incentivize the use of digital technology, the use of HMIS or EHR or EMR. In January 2023, we have launched a digital health incentive scheme, wherein if a hospital makes digital records which are interoperable, we would provide them financial incentives of rupees 20 per digital record, and incentives up to rupees 4 crore can be given to a health facility. We have received a reasonable response after this scheme. However, a lot needs to be done. As I mentioned, um, all of you who are here, um, they can uh, they can look at the stall that we have launched. We have set it up here. Our team is here. You can ask questions. If there are any input suggestions, you please let us know. If we can use the power of technology uh, to alleviate uh, the sufferings or the pain points that a patient suffers while accessing healthcare, uh, uh, that's the mission. That's the mission's in the main aim. One of the things that we have done recently and which we are very proud of is an initiative that was launched last year, and yesterday we have achieved a milestone of 1 crore quick OPD service. So what happens is that this was typically for government hospitals where there is huge crowding. So when there is huge crowding at the registration counter, what happens is that whenever a patient goes, they have to say your name, your age, your mobile number, your address, and then you say you want to see an ophthalmologist or a orthopedician. What we have done is, there is something which you might have heard of, is called an ABHA number. ABHA number is like your Aadhaar number. It has your demographic details, it has your name, it has your gender, it has your birth details, your address. So you go to a public hospital and there is a QR code over there, and you use any app. You use Arogya Setu, you use our ABHA app, you use Paytm, you use Briefcase, you use Eka Care, or 10 other apps. You go there, you scan the QR code at the public hospital, and immediately you will get a token number 42. So when 42 number is displayed at the counter, you go at that counter and you merely have to say that कि आपको किसको दिखाना है, because all your demographic details have already been transferred through the app to the HMIS or to the EHR. And we have seen that this uptake in public hospitals, particularly in Uttar Pradesh, has been phenomenal. And I would request if you can visit one of the public hospital in Uttar Pradesh, or RML or Lady Harding or Charak Hospital, or AIIMS Delhi in New Delhi, you will be able to see the power of technology in alleviating the sufferings. There are a lot of old people, lot of women, and lot of people in problems who are there and standing in long queues. So if we can use technology and solve the various problems that a patient suffers during his or her journey to access healthcare, we are trying to solve them. So with these comments, I'll I'll pause and I will request everybody to please visit our stall. If you are using, if your hospital is using an HMIS or a digital system, you can please get in touch with us, and we will try to make your HMIS compatible with our Ayushman Bharat digital mission, and we will like to assist you in becoming interoperable. And if your hospital does not have a digital system or an HMIS, I would strongly recommend that you use one. Thank you. Thank you.
Thank you, sir. Your mission is our mission. Digital health is the only way to go. I can assure you, each one of us in private sector,